Hello and welcome to my PowerPoint on clindamycin. What is clindamycin? Clindamycin comes from a class of medications called lincomycin antibiotics. It can be administered as injectable, intravaginal, topical, and oral. For this presentation, I will be focusing on the oral administrative form of clindamycin. Clindamycin has shown to help against both gram-positive cocci and gram-negative or positive anaerobes. This means it can help in the treatment of infections in the head and neck, respiratory, bone and soft tissues, abdominal and pelvic areas. It can aid in the treatment of lower respiratory infections, gynecological infections, septicemia, uncomplicated skin and soft tissue infections, and patients with allergy to penicillin medications. Pharmacokinetics. Absorption. When taken orally, more than 90% of the medication is absorbed in a short amount of time. Within about 45 minutes, peak plasma concentration is achieved. The bioavailability is nonlinear and will decrease as the doses increase. Unlike other medications, food does not affect the absorption capability of clindamycin. The AUC of a 300 mg dose of medication was found to be approximately 11 micrograms per hour per ml. Distribution. Clindamycin isn't distributed into the cerebral spinal fluid, even in the presence of inflamed meninges. However, it is distributed through the rest of the body, including into the bone, tissues, and bodily fluids. Clindamycin concentrations increased with increased dose. Serum concentrations exceed the minimum inhibitory concentration for most indicated organisms for at least 6 hours after administration of the drug. Metabolism. Clindamycin undergoes hepatic metabolism. This means that the medication is metabolized in the liver. It is metabolized by the cytochrome P450-3A4 or CYP3A4, with some contribution from the CYP3A5. This forms clindamycin sulfoxide and a minor metabolite in desmethylclindamycin. Elimination. Clindamycin has an average half-life of about 2.4 hours. It has been found that approximately 10% of the bioactivity is eliminated in the urine and 3.6% in the feces. The rest of the medication is excreted as bioinactive metabolites. Pharmacodynamics. Clindamycin is active against gram-positive aerobic bacteria, including Streptococcus, Staphylococcus, and Pneumococcus. Clindamycin is also effective against both gram-positive and gram-negative anaerobic bacteria such as Bacteroides, Fusobacterium, and P. fragilis. Clindamycin works by binding to the 50S ribosomal subunit of bacteria to inhibit microbial protein synthesis. It does this by interfering with the transpeptidation reaction, which then causes an early chain elongation. This in turn can slow or even stop the growth of bacteria. Clindamycin has a short Tmax, or time it takes for the medication to reach maximum concentration, and half-life. This is why it is 6-hourly administration essential to ensure adequate amounts of antibiotic concentration is maintained. Interdisciplinary team. Clindamycin is a Schedule 4 medication. This means that a prescription is required to acquire this medication. Clindamycin can be prescribed by either a general practitioner, midwife, nurse practitioner, or dentist. This medication is also part of the PBS, the Pharmaceutical Benefits Scheme. A valid prescription is needed to purchase this medication, and the prescription must be filled by a certified pharmacist. It is recommended that the patient follow up with their doctor following the round of antibiotic medication. Patients should be educated on how to safely administer the medication. Clindamycin is safe to use during pregnancy as long as it is taken as directed by the prescriber. However, it should only be taken in pregnancy if clearly needed. Should the patient become pregnant while taking this medication, they should inform their doctor immediately. This medication should not be taken by breastfeeding women and is not recommended for children due to formulation reasons. Patients should ensure they follow the prescriber administration instructions and discuss any concerns they have with their prescriber. For the medication to have the best effect, the full round of antibiotics should be taken as per instructions. Care should be taken when handling heavy machinery until it is known how clindamycin is going to affect the patient. Adverse reactions that may occur include loss of taste or taste disturbance, itchy skin, nausea, and or vomiting. These are mild reactions that are usually nothing to worry about. If the patient is concerned, they should seek advice from their doctor. Heartburn, stomach cramps or diarrhea, joint pain and swelling, vaginal itching or discharge, skin rash, hives, or jaundice. These are more serious and should be reported to the patient's doctor to discuss whether the medication should be stopped. Severe stomach cramps or diarrhea and fever in combination with severe stomach cramps and diarrhea are more serious and may require urgent medical care. Serious allergic reaction, including swelling to the face, lips, mouth, or throat, which could create difficulty breathing. Severe skin reactions accompanied by fever and chills, aching muscles, and general feel sick. Chest pain and or shortness of breath. Swelling in limbs, decreased urine output, irregular heartbeat or confusion. These require urgent medical attention through an emergency department if possible. Although there are many possible side effects, it is possible the patient may not experience any of them. If patients experience any possible side effects and or are worried about feeling unwell, they should be encouraged to speak to a pharmacist or their doctor. Let's test your knowledge.